Okay, so we are here with Kristin Liabo today, and I'm going to present a little bit about what these sessions are all about. Then I'm going to hand over to Kristin, who you are all here to hear from. So let me just share my slides. So yes, so this is a series. This is a session today about capturing impact from public involvement. And we have Kristin Liabo, who you'll be hearing from later on, and I'm just going to give a very quick update about this. Housekeeping. So this is recorded. This is less of an issue because, as I said, we've set this up as a webinar today, so we can't see you, we can't see your names, and we can't see your pictures. But this will be recorded and it will be shared on YouTube. The link will be shared with you all. But because we can't see you, and because we do want you to be able to ask questions and ask them whenever you need to and whenever you want to, if you can look at, there is a question and answer function on Zoom, and if you could try and use that to put in your question, that would be great. We do have some colleagues who are supporting us today as well, so if you do accidentally put something in the chat, they will try and either move it across or answer your question. But if you can see and use the question and answer function, if you can, that would be great. As I said, our fabulous Nikki is doing far more important things today, so we just bear with us on the technical support. They make this absolutely seamless, and there's a lot of invisible work going on, which you realise when your colleagues aren't there. So yeah, just please bear with us. We have kept this as a webinar to keep it as safe as possible, to ensure people don't necessarily interfere with what we're doing today, and that's just because of our learning of how to run these events without Nikki. So just bear with us, and so it'll be a little bit more formal perhaps than we're used to and a little bit less community focused, but we're hoping that we'll go back to a community feel as we've learned what we're doing. So today's session, I'm just going to give a very short introduction of where this all sits, why these sessions started, how they all fit in the whole wider discussion about impact. Then I'm going to hand over to Kristin, and I've realised I've spelt your name wrong, Kristin. I'm very sorry. It's obviously the German speaking in me rather than the So I'm going to hand over to Kristin Liabo, and then who'll present, and then we'll have questions and answers, and then we'll finish the session by 1 o'clock. So this is part of wider work that's going on to understand and advance evaluation and learning of public partnerships. I use this term public partnerships just because it's what we've used in the NIHR at the moment, the National Institute of Health Research. I don't mind what term people use, but basically it's just about how everyone works together to shape health and care research, how carers, how healthcare professionals, researchers, how the public, etc., all work together. And this work has been going on for a while. The discussions have been going on for a while because we work in settings which really want us to understand what we do and really want us to figure out how do we show the impact of this work, and that's possibly because of the influence of the health and social care settings that we are in. So as part of that, these sessions aim to just bring us together as a community, share examples of what people are doing, knowing that there's no right way or wrong way to do this. It's just there may be different options out there. And to really start having the discussions or to continue discussions about actually what is it that we can do, and perhaps inspire people through the examples that we have shared. It's really important to acknowledge that this work already builds on work that has been carried out before. So I really want to acknowledge the work of the NIHR Patient and Public Involvement Impact Working Group. And in 2019, they created this definition of impact because they felt the term impact was just so incredibly nebulous. It was really hard to understand what people actually meant by that. So they created this definition, and impact for them was the changes, benefits, and learning gained from the insights and experiences of patients, carers, and the public when working in partnership with researchers and others involved in NIHR initiatives. And the reason we're sharing this is because there was initial discussion when we had discussions with people in about 2021, sorry, not 2001, 2021. They were asking us to define impact again. And some of the people who were on this working group reminded us that we already had this definition, that it's not perfect, but it's good enough. And actually, perhaps instead of defining it again, we can do more work on just sharing our examples of how we do that and how do we capture the learning from what we do. And this all fits into obviously the wider strategy that we follow in the NIHR and the National Institute of Health Research. I will, try and keep my acronyms to a minimum. They do slip in, so apologies. That wider strategy is called Going the Extra Mile. And crucially, what this really highlights and tells us is it reminds us to ensure that public involvement isn't just an end in itself. It's just not just an exercise we do just for the sake of doing it, that it does have value, it does lead to something, and that can be learning as well as better health outcomes. So this fits into 5 key areas that Going the Extra Mile strategy highlighted needed to be strengthened and improved for public involvement in health and care research. And as you can see, impact and learning is one of those 5 key areas. And going back to those conversations in 2021, we had conversations with a number of different people over 2021, and what they highlighted was 2 key priorities. One was to define impact, which, as I said, we changed that then to share the 2019 definition of impact instead of defining it. But the second priority we've kept, which is collating and sharing examples of how this is done across the National Institute of Health Research and beyond. And that's where these sessions fit in. These sessions are a way of just helping us ensure that we can really continue discussions, build a community around this. So we've already had a session in 2023, which was Whose Impact, led by Lynn Laidlaw. We've got Kristin today with us, who's going to be talking about capturing the impact from public involvement. And then we've got a couple of future ones planned, one on logic models and program theories. And then I do need to work with the people who were originally part of the network to officially launch this network as well. That's just me being slack, but we invite you to share your views as well. And Nikki's already done loads of things behind the scene to help this event run seamlessly. So I really want to thank them while they're on their more important job. Really thank Katie for stepping up and helping us with this as well. And also really want to acknowledge the work of the previous NIHR Patient and Public Involvement Impact Working Group. I'm just going to hand over to Kristin now.
Great, thank you, Murat. So I'm going to share my screen. There we go. And there we go. So hopefully you can see my slides now. Right, so I just need to sort of move things around a little bit on my screen. So thank you for the introduction to the overall kind of where I fit in, Murat. It's really helpful to have that. And thank you for having me. So I saw a call for content to these seminars last August, and I responded, and I thought I'd share what we've been doing here at PENARC, which is the NIHR Applied Research Collaboration for the South West Peninsula. So PENARC for short, and that's an acronym I'll be referring to quite a lot in this presentation. At PENARC, we have a strategy for public involvement, and when we wrote this, we actually did a poll with public members or advisors or partners, collaborators, patients, carers that we were working with. So we did a poll about what term to use for the strategy, and the winning term was public collaborator. So that's the term that I will be using in this presentation. And then I will be using PPI for patient public involvement. And I will assume that everybody here knows what that is, but obviously you can ask in the chat if you're unsure. So The presentation that I'm going to share with you today is a conglomeration of knowledge from various PNARC PPI team projects, which were all done in collaboration with our public involvement group, which is called PENPEG for short. So that's the Peninsula Public Engagement Group, and also other public collaborators from the past and the present, and researchers at different organizations in the UK and abroad. And I've listed some of the publications here that I draw on, but there are more that I sort of draw on here, and also some unpublished materials that we have. And this is just a boat that we built at a public engagement event at the beginning of our current funding period with the ARC. So we built a little ARC to represent what we're doing. Okay, so in this presentation, I'm going to start by briefly sharing my thoughts on why impact might be important to consider in relation to PPI in research. I will consider what impact is very briefly before I provide some examples of how impact can be considered and captured from public involvement, just going through some of the work we have done here at PENARC. Okay, so the call for impact can be seen as coming from a desire to avoid tokenism. So if researchers are asked to provide evidence of impact, that means they have to ensure there is impact. And it is worth revisiting this well-known ladder of participation, which was designed by Arnstein in 1969. There's loads of versions and variations by others since. But I think it's quite sort of insightful to look at what she defined as tokenism in participation. She wasn't talking about PPI in research specifically, but I still think it's quite interesting. In fact, the placating, informing, and consulting rungs on this ladder is often where we find descriptions for how public collaborators were involved in a study. And I'll show you an example. Now, please don't take this as a kind of, because it's emerging work, but this is an extract from a piece of computer-generated text from involvement sections in a journal, which asks authors to outline how patients were involved in their research. So this text that I'm going to share was informed by the typical phrases used in these sections. Okay, so what researchers say about public collaborators: their involvement is essential, their expertise is crucial, their input is valuable, as are their insights. But when we listen hardest is when they show enthusiasm and support, when they tell us our research proposal is important to patients, acknowledge the importance of our research topic anonymously, I can never say that word right, find that our area of research is important, feel that information provided is clear and comprehensive, agree that our study is an important priority for further investigation, say that addressing these issues is important, express enthusiasm about the focus of our research, think that our methods are acceptable, or best of all, when they are enthused by the size of our study, their strong support, their full support. So looking then back at Arnstein's ladder, the placation, consultation, informing are clearly mirrored in this extract from those involvement sections. And I would say then that we could see the desire to evidence impact can be seen as a way of bringing PPI up this ladder. Yeah. Okay. The flip side could be, and this is just me kind of being a bit cynical maybe, the impact could be seen as a quantitative outcome of involvement. So if we can't count impact, it means that there was no impact and the involvement was meaningless. Or if we can only count one impact, it was poor involvement, but if we can count many, it was good. And there are vested interests in academic communities where it might suit certain people to have evidence of how involvement does not have impact, because involvement is quite time consuming and challenging, can put researchers out of their comfort zone. It requires resource. It would be therefore quite convenient perhaps for some actors within the system if it was found that PPI hasn't got any impact. But I mean, that is just me being cynical. I haven't got any evidence for that. But I think it's something that maybe we should be aware of. Yeah, we don't want it to be thrown out just because we can't find immediate impact. So moving on to what we mean by impact from involvement. So actually, Mirad shared a really helpful definition earlier. Christina Staley has defined impact as exactly what difference involvement makes. She says there has been much interest in obtaining evidence to demonstrate added value and to find out where involvement, where and when involvement brings the greatest benefit. Yeah, so in health research, obviously, impact is often ascribed to interventions, intended and unintended, direct and indirect effects produced by an intervention is one definition by Patricia Rogers. Some have suggested actually that we can consider involvement as a complex intervention and consider impacts from it as you would for other complex interventions, such as community-based mental health support or person-centered care. So impact could be considered along a line like we've got here, where you got sort of a study and then you got involvement and then you got a new study. So it goes from being square to round sort of thing. And I think in some cases that probably is quite easy to track. But I often find it quite difficult to consider it in that way. Because in practice, my experience is that involvement is a process of relationships, meetings between loads of different kinds of humans who work together and who differ all the time and work together in different ways. So there's multiple microprocesses, and these vary and vary from team to team, from study to study, depending on the topic and who's involved, etc. Now, of course, complex interventions also contain human relationships, but at least there's usually a clear focus of the intervention, for example, to improve diabetes care or enhance self-management or whatever. But with involvement, the intended kind of impact, what we want from it, again varies from study to study. And often we should be keeping an open mind to unexpected impacts because we need to be aware there might be blind spots of missing information before the involvement that we weren't aware of. And that's, some of the most exciting events, I guess, in involvement is when somebody points out something that the researcher hadn't thought of already. Yeah, and sometimes you got really a lot of involvement kind of in co-producing the application and the plans for it, and then maybe less in the implementation of it. And it might be more governance to ensure that things go as they were planned. And that doesn't mean that that involvement is less impactful in a way. And in most studies, when involvement is integrated to have impact, there might not be a clean line of impact, but instead a meandering of lines. Some input leads to impact and others don't. And it can be a lot of different reasons for why something has impact and other input doesn't. Okay, so I'm going to stop there, but let's think a little bit about what we want to have an impact on in involvement. So here's what I'd call an impact flower from involvement. I think I'll encourage everybody to go out and create their own flowers and how they want the impact flower to look, and thinking about how to grow it. But this flower is based on reading a lot of literature on impact. So let's look at the different petals. We've got some yellow ones here. Those are related to impact on the research study, its design, how it is implemented, and how the data is analyzed, etc. And these areas are kind of natural targets, I guess, for involvement and to create change from involvement. We're talking about involvement in research, and a major reason for why we do it is because research can be made more relevant and useful from having broader involvement, not just researchers involved. Looking at the orange petals, these are also about research. So we know examples actually from the past where research methods have changed because of input from people with lived experience, not just the focus of the research, but actually kind of trial design, etc. And involvement can also impact on the system of research and on funders, and actually we've seen quite a lot of initiatives in the past years from some funders that aim to help community organizations be more involved in research, for example, and I'm sure that PPI has been part of bringing about that change, so that's another type of impact. The red petal of this impact flower highlights the main conduits for impact, perhaps, being researchers. So when researchers want to hear what public collaborators have to say, when they really listen and take in what is being said, it is my experience that there is impact. And that impact can be on researchers' knowledge and perspectives. It can bring enjoyment or frustration. It can block or enable impact, actually. But if researchers are impacted by PPI, so most likely will the research be as well. So that's kind of that. And now I'd like to just give you an example of where there was a lot of impact in a study. So the Hemisphere study started out as a workshop about an entirely different study idea. So there was a surgeon and he wanted to meet with members of PenPeg, and we facilitated a workshop with him and a statistician. And in that workshop, PenPeg members told him that the outcomes he wanted to improve for hip fracture patients were marginal, not that important, and they weren't that interested in the intervention that he was proposing to research. They told him he should be first and foremost focused on interventions that can improve mobility after hip fracture. And it was really great to see. The surgeon had to leave the meeting a tiny bit early, so but he was so excited when he left the meeting. And instead of saying no, he said, "Wow, this is a whole new way of thinking about it for me. I need to clearly speak to the physiotherapy team." And he did so on his ward. He looked for outcome measures that focused on mobility, and he just changed the whole focus of his research from that meeting, and planned a new study inspired by those conversations. So I'm just going to show you a little video where Alex, one of the carers who were involved in the study, and John, the surgeon, speaks for themselves. And Meret's going to help me share that little clip.
The project really is looking at two ways of doing hip fracture repairs.
There's a standard one that is accepted in this country, and an alternative approach that can bring them back to a level of mobility closer as before they fractured.
We had a workshop with patients, and the first thing when they finished their presentation, a carer who was in a group said, "That's all good and well, but none of this is important to me and my mum."
The basis was that actually there's very little research on which way was best.
The surgeon, John Charity, who was going to lead the study, he was just so happy. He was invigorated.
John listened and he came back with a solution to my questions. And I was very excited by the fact that he actually went away and thought, well, how can I make this happen?
It's very interesting to see the insight provided by a PPI representative. I really feel that it does make complete sense because we're studying patients. Clearly, you need someone who will be an advocate for them.
The work.
The project really is looking at two ways of
you
doing
can turn it off now. Yeah.
The standard one that is accepted.
It's on a loop. Great. Thank you, Meret. So that was just kind of to show you that little clip there. Okay. So I think I'm sharing well now. Can you just nod, Meret?
Yes.
Yeah. Cool. Thank you. Yeah, so that is a very clear example of impact. A researcher attends a PPI meeting, his perspectives are changed, he changes his study idea. However, even this impact could actually have been missed because John might not have attributed the change to the PPI meeting. He might have taken all the credit for himself. He might not even have intended to take the credit, but simply forgot because he got bogged down in high workloads and career demands. And given that the original PPI meeting was actually about a different study, it's possible that it won't feature in the final report of this trial. But actually, after the meeting, John himself wrote an email where he said the workshop had been an eye-opener. So he was there capturing that impact. And I just wanted to make, that there are some times you think it's not possible, but it could have been forgotten. And here we go, the researcher at least remembered it. So going back to the impact flower again, another area of impact is of course on public collaborators. So that's the deep pink petal here. And again, the process of involvement can impact on their knowledge, perspectives, frustrations, as well as enjoyment. So the light pink petal refers to both researchers and public collaborators. And some of the literature I've read speaks about empowerment through involvement, which I don't like to kind of think that I can empower people. I think people empower themselves. But of course, if being involved in a study that I'm involved in makes public collaborators feel empowered, then that's really great. And it would be very valuable to capture how that happened, how they found power or felt empowered, or yeah, and how they used it as well. I think it's equally important to pick up negative impact from being involved because, and that goes into the green petals. Involvement is about relationships across boundaries. It touches on public trust in science. So if we have a tokenistic involvement, it can be harmful at many different levels. It can harm public trust, willingness to participate in research, future involvement. It can harm the value that is put on research by communities and the public. And I'm not going to talk about the harm today, but I think it's something that we should talk about more because it is, of course, extremely difficult to call out. Okay, so if we go back to the original ladder, I think here impact means power. It isn't countable, but it can be evidenced. We can look at whether public collaborators have a vote at a table when important decisions are being made. Do they have anything they can influence through their roles? Are they involved in conversations and invited to discussions about important matters? Okay, so I'm going to move on a little bit now. Alex, actually, and this is just pure serendipity, but Alex, who featured in the short video clip several years ago, when I was new to PENARC, he said to me at a meeting, why don't we do more work on finding out what PPI is and does? And at the same time, my research seniors were also telling me to focus on producing research and publications on PPI. And so in this instance, one public collaborator and two senior researchers independently impacted on my behavior. And I initiated research on PPI within PENARC. So it's important to kind of point out what was it that spurred on what I'm going to talk about next. Now, what I'm going to talk about next might have happened anyway, after all. I had done this kind of research before I came to PENARC, and it was kind of part of my role, but it would also be wrong to say that these people didn't have any impact on this because they definitely spurred me on to start when I did as well. Now, so I had that kind of call to look more in depth at PPI and do some evaluation of it and some research and do it on the work we do here at PENARC. Now, because organizing and setting up PPI meetings is quite time consuming and needs to happen relatively fast at times, what I did was I applied for local ethical approval to conduct research on PPI that we did. And it was agreed with the local ethics committee that we would have an overarching application and approval. And then for individual projects we wanted to include, we then had to apply for additions to that to do the work. So that means that I have an ethics application to do PPI research, but I can't just use that to go out and collect data on whatever project I want. So if a project comes up where there's interest and resource for researching the PPI, we first approach everybody involved to ask if they are in agreement that this is worth pursuing and they want to do it. And then so that would be the researcher and the public collaborators. And then we apply for an addition to our existing ethical approval if everybody is happy. Now, because the design, study questions and ethical procedures have already been scrutinized, the addition can be approved more quickly than a full application. So the overarching project is called, what is this thing called PPI? And it took quite a long time to work this up, because obviously we wanted input, and we did that with the members of PenPeg, so our public collaborators. We wanted them to have a say in what we looked at and how we looked at it. So they had input both on the focus of the proposed research and the ethics materials that we would be using. And they also informed the additions that we have applied for. But the three areas of investigation, if you like, that we focus on within this project or in this program of work is, what do people contribute? So what kind of knowledge is included in PPI? How is PPI best facilitated to enable people to contribute? And then the last one is about impact, and that's the one I'm going to focus on now. So in the ethics application, we listed several ways that we would collect data. So we have reflective cards where people are asked to note down their expectations and experiences of involvement before and after meetings. And then interviews about involvement with researchers and public collaborators, and then through observations. But perhaps one of the most revealing methods that are included is the recording of meetings, so audio recorded meetings. And this has been particularly revealing when combined with report cards, because what people remember from meetings and what was said can differ. And I'm going to give you an example from one meeting, just one meeting. Okay. So in this meeting, now we have more data from that meeting, from that project, but I just think this is an interesting example. So this is from one meeting in a project. There were 6 researchers who were there in person, 2 researchers on a call, 1 PPI facilitator, and 3 public collaborators. It was a very formal meeting. People sat like in a committee setup, and it was the first meeting of the study. And everybody, of course, agreed to be recorded and consented to involvement in the PPI study. That had already happened. And then some filled in record cards after the meeting, reflecting on the PPI, and also some were interviewed about the PPI in the study. So it's kind of a bit convoluting when you, no, sorry, you get this, we are studying a study. So that's the thing with PPI research. Okay, so I'll show you 2 of the record cards first after the meeting. So these were reflections that were shared by email I'll show you one researcher, then another one afterwards. And just to say also the study focus, it was a systematic review that we're doing. Okay, so the first researcher said to the question, what value do you think PPI brought to the meeting? I thought it was good to have the PPI reps at a meeting. I think they were a useful addition in terms of making sure we were doing something relevant to patients and the public. I'm not sure how much difference they actually made, especially in some of the technical discussions. I think systematic reviews may be a little different to more clinically based studies in this regard. In view of this, I did wonder if there was a slight overload with 3 of them plus yourself versus, I think, 5 members of the research team plus 2 on the phone. I didn't think this made much difference, however. So kind of like a lukewarm, but fairly happy response there. Sees the value of PPI, but maybe not in terms of making big impact. Okay, the second one started very similarly. It grounded the project in reality. Ultimately, all that data represents a real person, and it can be easy to forget that. And then their reflection goes on. There were some specific project actions that can be attributed to the PPI group. The inclusion of both a lay summary and the section detailing the PPI plans in the protocol. There were discussions initiated by the PPI members about the meta-analysis, which clarified the intention of the plans for this for everyone, and an agreement to write a statistical section in the clearest language possible. So there's an impact here on clarity. Also, this person's picked up that there were some kind of actions as well in relation to PPI specifically. Okay, so let's look at the interview. Now, I don't know, so I said he, but actually I don't know if those two record cards, who they were by, so I don't know who they were, and I don't know if they are the same person who was interviewed. We have to be really careful that we try to anonymize this very clearly, so people aren't identified. But I want to show you an extract from the interview where one of the researchers reflected on the meeting. So this person says, so there are interesting examples of them challenging things our statistician might say, and quite interesting interactions in getting them to come down to earth slightly and talk in a language that we can all understand. So bringing that equalization together was quite interesting. Yes, and there's quite good interaction in the sense that I certainly don't always understand what our statistician is saying, and we sort of empowered each other to bring out into plain language that we could both understand. So I think this is an interesting impact because clarity of communication is really important in a multidisciplinary team, and increasingly more important the more complex studies get. And it can be a catalyst for further impact. So you might not think that clarity of language is that important initially. It's not a strong impact, but because it's not changing the research or the researcher's perspective, but actually by impacting on how we communicate about research, researchers in multidisciplinary teams understand one another better, and this can lead to further impact on team cohesion, collaboration, knowledge, etc. It's quite basic, important actually. Right, let's look at the meeting recording then. So some of what was said on the record card, the second one, and also in the interview was corroborated in the recording, where we could see that interaction, where a researcher says to the statistician, actually, I was trying to explain this to our public collaborators before the meeting, and could you explain a bit more, because I struggled to do that, etc. But actually, we noted another impact when we looked at the details of the meeting. So this interaction was quite long, so I've just pulled out a couple of things. So first, it starts with one public collaborator who asks, how will you be 100% satisfied that the equipment used to measure whatever it is totally comparable? I don't know if these things have to be calibrated, how many manufacturers there are, etc. And then this, I haven't included it because quite long and technical explanation to say that in the analysis, they will connect individuals in the data set with the measurement tools used for them. And public collaborator B picks up that the researcher's answer doesn't actually address their colleagues' questions, so which is about calibration. So they say, but within your practical experience within surgery, do they have to be calibrated or checked or whatever, the equipment that's used? And then what follows is a technical discussion between a couple of 2 or 3 researchers around the calibration, how this is picked up in the data collection, etc. And this exchange actually did result in an addition to the coding of data. And that was recorded in the meeting minutes and later observed as a change in the protocol. So the audio recording for this meeting was used both for our research and for minute taking. And it's quite likely that I would say that the minutes might have missed out who prompted that protocol change unless it had been audio recorded, because I think here's an example of 2 things, probably more, but the audio recording helped to track who raised a particular issue, obviously. But it shows that when someone raises a question as a public collaborator or a point, the subsequent change to the research might be attributed to the researchers because they're the ones answering the questions and kind of solving the solution. right? So that's where you could easily miss the kind of the PPI impact. PPI is not a linear kind of thing. It goes in mysterious ways and actually could easily be invisible. Okay, so in sum, the PPI in this one meeting impacted on the clarity of communication, which can be a difficult impact to pick up unless you record a meeting, I would say. The recording also allowed us to evidence how the protocol was changed after this meeting due to specific input. We also had a new code for data collection, so that was impact on the research design. And there was more information on PPI included in the study materials. So this is very kind of fine, detailed analysis of impact. But then it's worth to take a step back and just think what's actually enabled this impact. So it'll give you a tiny bit of context. There was a pre-meeting before. Actually, I said pre-meetings, but that was a sort of practice that was developed that they did throughout this project. But there was a pre-meeting before this meeting I've just presented from, where they had discussed the agenda. So that could have enabled the public collaborators to feel more able to ask questions. Also, the chair acknowledged public collaborators as important contributors to the study. It was emphasized it was okay to ask questions, and the questions, when they were asked, were answered quite thoroughly, very technically, but thoroughly. Also, it's important to know that it could be that PPI had a particular sort of value in this study by the researchers because they had tried to apply for funding before, had been knocked down, and then after they had PPI, they got the funding. So there's the context again. That could be part of enabling the impact. Okay, I'm going to give you another example. This is a very different study, but another one where we did the recording of meetings. So here we had it was much more consultative approach. We had 4 meetings, all with the same focus. One researcher attended all the meetings and then kind of reported back to the research team. There were a varying number of public collaborators at the workshops, and the workshops were more kind of informal, a bit more creative, I guess, in their approach. And again, this was to inform a systematic review, the protocol of a review, and the focus was on cost effectiveness of a particular screening thing that could be offered on the NHS. Okay, so because this was of like consultative workshops rather than research meetings, we don't have anything from the meeting recordings around impact, but we have information on what type of knowledge people shared. So here is an example of a personal story that was shared to inform and help the researchers write a protocol in relation to why people might not, like what they should focus on. And one of the things was around some people don't take up screening. So this person says, no, my wife wouldn't. She won't even go in and get tested. She had a breast x-ray about 10 years ago. They keep writing to her, asking her to come back in. She won't. And I've said to her, have you got any lumps there? Well, that's why I'm not going in, because there isn't any. Oh, all right, suit yourself, do it your way. But the thing is, you know, if she did suddenly develop breast cancer, then the whole family is going to suffer, which is, you know, it's offered. She's not taking it. So that's a negative. On the offered one, it's offered and people not taking it up. That's a real bad seeing that. So this is just an example of kind of thing that they were talking about that came up in those meetings around not picking up screening. And this one too, don't worry if you can't read it, I'll read it out. But this is just to show you from the community center workshop we did. We used post-it notes rather than recordings. We asked people their views about this screening, and then we put it on post-it notes. And here's one saying that people might not take up screening offer because if they had to have succession of tests, including radiation, this would make them anxious. And another point made at that coffee morning was that whether people take up screening depends on their ability to cope with stress. And then people had other reasons for why we don't take up screening offers. If at work, it's less likely to, and I can certainly relate to that. And one person said, you know, I'm old, I will die when I die. I'm not interested anymore in this kind of stuff. And all this was fed to the research team. And then that was through the researcher who was present at all these meetings. And when we interviewed the head of the study later on, there was an interesting exchange around the impact that these kind of consultative workshops had. So he said the issues that we talked about in that other section's report were very much around the participation aspect, so that we would not normally have talked about. And there's no, if you think about a trial, the sort of research that you would do, you don't get very much information about participation rates. You mean why people accept it or don't accept. This person means the screening. Exactly. And this allowed us, the PPI allowed us to talk about that and say, we did this exercise and this gave us information about participation and non-participation. A hugely important issue for screening program. Absolutely, absolutely. And of course, in many cases, you don't find out about that until you've introduced the screening program. So here, although it's just a series of consultative meetings, there was still impact on the researchers' work, but this wasn't evident in the meetings. So yeah. Okay, so to conclude then, I think if you want to capture impact, you really want to keep a close eye on the response to the PPI impact put by the researcher. It's very challenging to track the impact and all the impact, because impact can be invisible and the route to impact is messy. So actually what I've come to conclude is it is important to try and capture impact, but really we need to think about the process more than the impact. So if the process is very collaborative and inclusive, and researchers learn to listen and hear what people are saying, then there will be impact. I want to highlight the work that I've just spoken about. I'm not suggesting that everybody should go and do something similar. It's extremely time consuming. Just writing the ethics application and writing it with people, writing it with researchers and public collaborators. Same with the ethics editions, and then just taking study, sort of sharing study information and consent and all that kind of stuff took a lot of time too. And then once you have the data, it's the transcribing, analysis, etc. It's very, very time consuming. And yeah, and I'm sure that we still didn't capture all the impacts. So I gave you the example earlier about the Hemisphere project, where we captured the impact simply by just kind of the researcher being upfront and sharing about it, and also the Alex and I being kind of very enthusiastic. I'm sure you could tell, super enthusiastic about the impact we had on John. So I think, you know, you can pick up impact without all this. But also, I think I would say it can be really illuminating if you can, not for research purposes, but just listen back on a meeting once, just to kind of hear what's happening. But it's really important not to do that and then write it up as an evaluation or a study. And obviously, consent is essential. I found Lundy's model of participation extremely useful in relation to this, and I wanted just finally to highlight that to everybody. This was developed for children and young people's participation, but I think it really speaks to what we've found here in PENARC as well. So the space needs to be right for the project, for the people involved, and people need to be kind of helped to find their voice. And sometimes people might need a little bit of encouragement, highlighting what they have to offer, because people can be a bit confused about why I'm wanting them to get involved, and they might be interested and open to it, but still a bit confused. So helping people find their voice and ensuring that there's space to share that voice is really important, and that there's an audience. The researchers should be in the room and hear what people have to say, so that there can be influence. Finally, a couple of references that I just wanted to highlight because I cited them. So that's Lundy from 2007. Voice is not enough, conceptualizing Article 12 of the United Nations Convention of the Right of the Child. It's an excellent, really excellent, although slightly old paper, still hugely relevant and relevant for adults, not just children. And then Christina Staley's, yeah, also quite old, but I think still stands. Thanks, everybody. I'm going to stop now.
Thank you, Kristin. That's really great. It was really interesting to hear, and great to see the progression of the work and how and what you found from it as well.
Sorry, I see I've gone over time massively. Apologies.
Don't worry. We do have some questions. Some are linked anyway, so we'll see how many we get through. I might try and ask, if we don't get through them all, we might ask to provide a written response just so we've got something that we can say to people. So people really liked the idea of the flower and the petals, the impact flower. There was a question of whether you'd worked with people, with patients and the public to shape that as well. And linked to that, it was because, I think partly as well, because people felt, or Sian in particular, felt that the impact for researchers was almost more detailed, and the impact for public was a little bit at a higher level, and whether that could be expanded a bit more, whether there could be more detail on that flower for the, the impact for public contributors as opposed to just the researchers. So
yeah, great input. I just put that flower together for this presentation. It's brand new. I've not really, so yeah, go ahead and grow your own flowers. Definitely. And I think that's a really good point. I think though that I'm always a little bit mindful of me not, so I didn't work with people on that flower. I will do. I think we should all go out and do that now. Thank you.
Created another tool, another approach. It would be quite interesting to do that, actually, have a flower at the beginning and then, assess it during. There is something about, are all PEN-ARC studies PPI studied? If not, what proportion?
Oh, I don't know. Yeah, most of them would have, no, not all PEN-ARC studies are studied in our project on PPI. Yeah, so I think we've only got 3. We got one in the pipeline for research projects that we have included in this. What is this thing called PPI?
Mm-hmm.
Yeah, but if the question is if all PEN-ARC projects have PPI, they should do. I hope it's 100%. And if not, I'm not doing my job right.
And there's another one from Ritika. In your experience, are researchers typically amenable to attributing a change in their way of thinking to prompts by public contributors, or do they need a bit of pushing?
Yeah, researchers come in many different shapes and forms. Some are so enthusiastic, and I think you saw that in John. He's a typical enthusiastic person. And then you have those who are quite clever and do it because they know it's going to get them the funding. I think there you might need a bit more pushing. Then some who are completely new to it and don't understand it and think it's qualitative research. So there's a whole wide, and I don't have a typical researcher. The closer you get to them, they're people. But yeah, no, it's a good question. I do think though we should try and find our inner strength to advocate for this more and push it more, because some people will not want it.
And can you just expand, just because we had another question about the resistance, so can you just expand on that a bit more, because then we can answer that one as well.
Yeah, so I'm often asked if I can provide some advice on PPI in studies, and I see that sometimes there's a reluctance to allocate resource to it. So recently I was asked, and could I be 5% on this? And I said, I'm not 5% on something that doesn't have PPI resource. You need to allocate money, and you also need somebody to do the work of PPI, who's going to go out and find people who want to be part of it, who's going to welcome them when they come to meetings, who's going to help them, with travel and payments and la, 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 la. So I just said, I'm not in if you're not resourcing it properly. Now, that's probably easier for me in my current position where I am now, but I think highlighting that this isn't free, that's really important. Try and find allies in your organization who can support you, especially senior ones. If you can find a professor who values this, who can help you, that's often the best. Yeah.
And in your studies, you worked with, well, when you were capturing the impact and using the record cards, and you worked with the PEN PPI group. Have you ever looked at including or working with people who aren't as knowledgeable about PPI in that whole capturing impact thing?
Yes, but informally. So no, wait, we did. Yeah, one of them we did, because we have, and it's best to work one-to-one because it is quite convoluting what we're trying to do. But for the second example that I gave, my colleague Emma Cockcroft worked with people who'd never been involved in research before. She met them in a cafe and explained and kind of went through it very carefully before the meetings. So we have done that, but it does need a bit of one-to-one meeting up and explaining, I think.
Great.
But then I've been working with a different kind of research study where we work with refugees and people who are seeking asylum, and they've had loads of impact on that study. But we haven't done the researching of the impact. We just recorded the impact after each meeting. So, for example, we meet with them, they give us input, and then it's just trying to make notes of it like you would when you take notes after minuting the meetings, and then capturing that for the NIHR report. So actually, I worked in lots of different ways, but the recording also, But I wouldn't do that with the refugees. I wouldn't record.
No.
Yeah.
No, there's lots of sensitivities there. Yeah. Great. Thank you. It's really well received. People are really interested and excited about what you've done. Just because of time, I am going to copy and paste the rest of the questions and answers, if that's okay, and then we can continue to communicate and share them back. And this has been a really great session. I really appreciate your time, and thank you to everyone as well who turned up today. Just in the interest of finishing on time, we will draw this session to a close. Thank you.